Good morning. Today we are going to discuss an article with the title An Experimental Randomized Study on the Analgesic Effects of Pharmaceutical-Grade Cannabis in Chronic Pain Patients with Fibromyalgia. So as the title says, it is a randomized study. So it follows, we have to just check if it follows the consort guidelines. This article was published in the journal Pain in the year 2019 with an impact factor of 7.96. So decoding the title. So it is a randomized study to find the analgesic effect of pharmaceutical grade cannabis. So what is cannabis? Cannabis it comes from a plant. So cannabinoids can be of three types. Phytocannabinoids which come from plants, endogenous cannabinoids where we secrete cannabinoid inside our body naturally, and there are synthetic cannabinoids. So these are the varieties of cannabinoids, and here they are using pharmaceutical grade cannabis, which means they are collecting the chemicals from the plant and they are making it to medicines. There are 5 types of pharmaceutical grade cannabis. We will see about it later. So what is the novelty of this study? So this study lies in its rigorous design. They have a rigorous design with a detailed pharmacokinetic analysis and comprehensive assessment of both efficacy and safety, which together enhance the understanding of cannabis as a therapeutic option for chronic pain in fibromyalgia patients. Fibromyalgia is a condition which I have already mentioned. It affects all the muscles. The patient will be in chronic pain, and there are different scoring patterns to diagnose fibromyalgia. I will talk about it later. Now we are coming to pharmacokinetic and pharmacodynamics. Pharmacokinetics is what the drug does to the body, and pharmacodynamic is what the drug body does to the drug is pharmacokinetics. Pharmacodynamics is what the drug does to the body. So they are in this study they have done both the pharmacokinetics and pharmacodynamics of cannabis. So the aim of the study is to provide a thorough evaluation of the analgesic and psychoactive effects of pharmaceutical grade cannabis in chronic pain patients with fibromyalgia. So as I said, fibromyalgia patients will have widespread pain, and which will be represented as a widespread pain index, and there will be a symptom severity score. So these two together, they will have some grading, and that grading will determine whether the patient is having fibromyalgia or not. So in this study, it was structured as an experimental randomized placebo-controlled 4-way crossover trial. So here randomized we understand, placebo is used as a control, and 4-way crossover trial. First, what is crossover trial? So we have trials as a parallel trial and a crossover trial. Parallel trial is we have 2 groups. One group will receive A, one group will receive B, and then it will be parallel, no interchange. In crossover, we have 2 sets of patients. Both will receive both the placebo and the expired testing material. So this is the crossover trial. And what is the 4 crossover trial? Here they have used 4 items and 4 testing samples. In that they have used in different time period. So they are, this is called as a crossover. They have done it, all the A will be having 1, 2, 3 in all the samples. So this is how the crossover trial is done. And they have used 4 different cannabis varieties, each with the THC and CBD. These are the 2 active the forms of cannabis, which is tetrahydrocannabinol and cannabidiol. So these are the 2 varieties which they have used. And this precise knowledge of cannabinoid content is crucial for understanding the effects of each variety. And how did they give cannabinoid as a medication? The cannabis was vaporized using a volcanomimetic vaporizer, and this is the volcanomimetic vaporizer. They placed a plant extract or something inside this, and they heated it to 210 degrees C or so, and then the vapor was collected in a 8 liters balloon. I think 8 liters, yes. It was collected in a 8 liters plastic balloon, and that plastic balloon the patient had to inhale. Not the patient, the participants had to inhale that cannabinoid. And how did they assess the pain? They used the bond and ladder questionnaire. It is only subjective assessment. So which utilized visual analog scales to measure the pain. So this is how a bond and ladder questionnaire will look like. They will have the answers. We will have to decide which one they have to choose. And safety monitoring, the adverse events were closely monitored throughout the study, and participants reported any adverse effects such as nausea or dizziness, and serious adverse events were treated immediately with no further measurement. So this they have done in the study. And they did the pharmacokinetics to link the observed analgesic effect of THC and CBD plasma concentrations for detection of potential pharmacokinetic and pharmacodynamic interactions. And statistical analysis, the sample size was calculated, which was 20. They used only 20 people, participants. To handle the dropouts also, they managed. They first collected 25 participants, of which 5 dropped out, and they kept 20 as the sample. And data screening was done for missing for any abnormalities, for outliers, all the data screening was done. They did a mixed model analysis, fixed and random effect analysis, and responder rate analysis. All these things were done. So the results, the patient recruitment and demographics were shown. As I said, total 25 participants were included, and then 5 were because of fear of needles and side effects, they withdrew from the study, and ultimately they took 20 participants. And pain assessment, at the start of the study, patients reported an average verbal pain score of 7.2 out of 10. So all the participants were diagnosed with fibromyalgia, showing specific scores on the as I said, the widespread pain index and the symptomatic severity index. They diagnosed the patients as fibromyalgic patients. And then the cannabis inhalation was given. The inhalation time for different cannabis varieties were given. Some were 5 minutes, some were 7 minutes here approximately, and so all subjects inhaled the complete content of the cannabis bulb. So these are the pharmaceutical grade cannabis. Here the names are Bedica, Bediol, Bedrobine, Bedocran, Bedrocan, and Bedrolite. So these are the types of cannabis which is given for pain management. And adverse effects were also noted. The adverse effects were like coughing, sore throat, bad taste, weak, high, dizziness, nausea. All these things were the adverse effects, and no serious adverse effects were reported. And the cannabinoid detection was done in the plasma. This is the graph which shows the cannabinoid detection in plasma. And the pain response were also recorded. And the responder rates for all the it is a 4 crossover trial where they used 3 varieties of cannabis and 1 placebo was used. And the psychoactive effects were also done, and where Bedrocan and Bediol caused moderate psychoactive effects significantly greater than the placebo. Bedrolite had less intense psychoactive response compared to the other 2 active agents. So the limitation was the sample size. It was only 20 and it was of a short duration. It was a crossover design. What happens in a crossover design, we will not know whether the effect is due to the first sample or the placebo. And the placebo effect was also, we cannot rely on the placebo effect. And subjective, it was all the subjective decision, and the exclusion criteria was very strict. They used the fibromyalgic patients without any systemic illness or like that. So all the exclusions cannot be generalized. The future scope is clinical trials are needed for this. The pharmacokinetics and dynamics should be explored more. We should see the long-term effects of cannabis, and we should do some comparative studies. Broader patient populations and mechanistic studies have to be done. So in conclusion, this study provides insights into the potential analgesic effects of cannabis in fibromyalgia patients, and it also underscores the complexity of cannabinoid interactions and the need for further research to fully understand the implications of cannabis use in chronic pain management. And the strengths of the study lie in its rigorous design, comprehensive assessment methods, and careful monitoring of both therapeutic and adverse effects, contributing to a deeper understanding of cannabis as a treatment for chronic pain in fibromyalgia patients. So on seeing the guidelines, so consort guidelines has title, abstract, introduction, methods. So almost they have followed all the guidelines, and they have mentioned all the trial registration number. The trial limitations were not properly mentioned in that, and generalizability was the trial findings was not given. All other things were satisfactory.